speaking about what it means to be a renter. So Aaron from Forward, Montana is going to talk a little bit about their work in housing in the renter world, and then we have our renter who's going to share her story.
Hello everyone, my name is Erin and I'm the Missoula Field Manager for Forward, Montana. Some of the things that we've done, we're a civic organization for those that don't know, and we aim to get young people involved in democracy. And about a year and a half ago, we started our Broke AF campaign, where we asked young people, what keeps you up at night? What do you worry about? And housing costs was overwhelmingly one of the top two choices, with education costs too. But we realized that across Montana, I mean, we polled people in Missoula, Bozeman, Billings, all the big cities, but then also in Howard and Great Falls and all across Montana. And we really found that housing was in crisis for young people, right? And we see kind of across the spectrum. I have the privilege of hearing a lot of renter stories through the renter work and the housing work that I do with Forward Montana. And we hear from, from the extremes all the way to just, I can't afford my apartment and I don't know what to do because there's a functionally 0% vacancy rate in Missoula, as a lot of people know. And so, if my rent were to go up at the end of June, I really don't have a place to go after that, right? So that's a huge problem that we're seeing, affordability, availability, and then of course maintenance issues and stuff. So I can talk about that more, but I kind of want to spotlight Ashley, who was someone who came into the Renters Union work that we were doing, and who just moved here in January and had a really specific experience that mirrors actually a lot of what I have found with a lot of the renters that I talk to. So I'm going to pass it over to her, and yeah.
Thank you, Erin. You are awesome. Thanks for having me. Really appreciate you facilitating this. My name is Ashley Cutshaw. I am from California. We moved here January. We actually drove in when that huge whiteout blizzard was happening. Yeah, winter states, that's the thing. I've been humbled. So this is my story. I'll try and keep it brief, but it was January of 2018. We were moving across several states to land in Missoula. Made it through the Hellgate during the whiteout blizzard. We were trusting in Missoula property management as we had used them in the past. Well, my wife used them in the past. We had a solid experience, and the apartment we signed off on was very different than the one that we arrived to. Not totally out of the normal, but the building we were in, we're currently moving out of right now, was built in 1918. It hadn't been changed much since then. The one-bedroom, second-floor apartment looked over a good portion of the downtown area. It had a quaint little setup. It was really pleasant as far as decor and things like that, but it wasn't until we had to endure the cold nights, stormy days, we realized how badly underkept the location was. The windows were so outdated that the frame was apart from the wall in some spots, allowing for the piercing gust of wind coming through. We had 3 large windows on the whole side of one of the units. The window on the far side had a crack running the entire length of it. The heating was advertised incorrectly. They said it was gas. It was actually those panel electric things that run across the floor. The heaters were at full blast. We could not manage to balance the temperature inside the unit. During the colder months, we were spending about $200 a month for a single bedroom apartment. The average internal temperature in the worst parts of the months were anywhere from 55 to 60 degrees. There were other small inconveniences, such as no fan in the whole apartment. Every time we ran the shower, we created a tropical, humid rainforest, and to prevent mold, we had to open the windows in winter. The sink water ran, regular tap water, it ran dirty. We had small rocks and sand in the bottoms of our glasses. I've since been told that we're on aquifers. Am I mistaken? That's correct? Okay, cool. So I guess that's normal. No. With all of this known, there was the 2-week mark of living here. After 2 weeks, we got a notice on the door from a private realty company named Abel and Volker. Sorry if I mispronounced that. They were not known to us, so we contacted Missoula Property Management. Missoula Property Management knew nothing about this realty office or why they had any kind of inspection notice on the door. This was more than a bit unsettling, as the realty office was demanding a view of our home within 24 hours during a workday at about 1 in the afternoon. Missoula Property Management did not know about the inspection. They didn't know why they needed to inspect our spot. And apparently they didn't even know that the building that we had just moved into was now for sale. So, yeah, that happened. We politely allowed them in to inspect the apartment while I was home. I do work from home, so fortunately it wasn't too bad. I was able to be home and wasn't too challenging. Excuse me. They were not there to inspect. The realtor was showing our apartment for sale. After 2 weeks of living here and moving across the country, our new home was, being shown on a regular basis, sometimes as many times as 4 or 5 times a week. That was kind of rough, mainly because I have a dog and she loves human beings and she gets really excited, and I work from home and I'm a part-time university student, and I almost had to skip class once just to stay home so these folks could come in and look at our apartment, and that was just really stressful. What else happened? Yeah, that one day that I almost had to miss class, that was kind of the end of my rope. Having known all of this, the biggest problem was the heating. When we did contact several times Missoula Property Management, after 3 months, they finally told us that the landlord had decided not to fix the windows. Why would he? He was selling the building. Why would we fix windows? You have a heater. Apparently he was doing his minimum required task as a landlord, which was another fun thing. The overarching problems that I've experienced is just poor laws or lack of laws that are upholding basic standards of living for tenants. The lack of a rent cap in, I think, the whole state of Montana, which really surprised me. There's a lot of concern, not from me, but from other renters that I've spoken to, about retaliation in the form of eviction. If they try and do anything or talk about anything, that's scary. No communication between private realtors and property management. They might want to get a chain email. You can show them how to do that. All laws are in protection or favor of landlords. That was me in my emotional state. I wouldn't say all of them, but definitely a majority of them are in favor of the landlords. This needs to change. Renters make up, and don't quote me on this, I heard this from somebody else, I have no citations. 51%? I said 54, thank you. 51% of the population, we are the majority. Landlords who own property and collect profits, they're not being held accountable, at least not by my personal standard. That's my personal opinion. Upkeep on communication, taking advantage of this structure. I really would love to see more laws that are for the betterment of both sides. I think that that would be a really great thing to try and strive for. Yeah, just, weatherproofing windows, having drinkable tap water, rent caps, and things like that. So that's pretty much in a nutshell my story. I was trying to make that quick. Thank you for listening.
Thank you very much for sharing your story. And if you don't already know Forward Montana, you should, because they really are all about empowering, mentoring, and getting the next generation involved in democracy and leadership roles. So, wonderful organization. I'm proud to be in the Forward Montana Rockstar Hall of Fame. So my name is Susan Haid Patrick, and in addition to being in the Forward Montana Rockstar Hall of Fame, I'm the CEO of United Way of Missoula County and a member of the Missoula Invest Health team. And I'm so glad to see you all here, and thank you so much for sharing your stories. No, like sand and particles in your drinking water is not normal, so even over an aquifer. So Invest Health is a collaboration between the Robert Wood Johnson Foundation, one of our country's largest healthcare funders, and the Reinvestment Fund to transform the way local leaders in small to mid-sized cities work together to create solution-driven and diverse partnerships. Our charge is to develop new strategies to increase and leverage public and private investment to accelerate improvements in neighborhoods facing the biggest barriers to better health. It's a new initiative, and Missoula is one of 50 cities selected by Robert Wood Johnson. It was a highly competitive process, and we were very honored to be selected to create and leverage these new partnerships to improve resident health and well-being in our lowest income neighborhoods. So changes that the foundation is looking at and that our cities are working on in Invest Health can focus on increasing access to quality jobs, affordable housing, nutritious food, and reducing crime rates and environmental hazards. The other members of our team, you've met Karen Myers from Providence. Thank you very much for having us here in this great facility. Kaya Peterson of NeighborWorks Montana, you'll hear more from Kaya. Laval Means with the city of Missoula, who is not in town, but an active member of our team, and our fearless leader, Lisa Biskevich, with the Missoula City County Health Department. We've been working over 2 years together as a team, and not long ago, we had one of our final convenings of Invest Health, and it was kind of like a science fair. All the cities could lay out on these different tables their journey in Invest Health over the preceding 18 months, like what they had done. And then we could all go around and look and see what other cities were doing, and they encouraged us to find other cities that seemed similar to ours or were working on similar issues so that we could learn from each other. Well, I immediately liked the people from Wisconsin because they had cheese curds at their table. And that was awesome. And Lisa liked the Iowa City people because she thought they were doing some exciting thing. I was all about the cheese curds. We, a few months ago, had an opportunity to apply for a second grant. Oh, let me talk about the accomplishments in our first grant very briefly. We did neighborhood walkabouts, we did a resident survey, we met with neighborhood councils, we reached out as much as we could to people in those neighborhoods to find out what they thought would improve health and well-being and advance health equity in their neighborhoods. Things like sidewalks, lighting, better trails, better access. Everybody wanted sidewalks. And that led us to apply for community development block grant funds, and with 2-to-1 matching funds from the City of Missoula budget, we were successful in securing $260,000 in CDBG funds and $560,000 from the city for a total of $820,000 in new sidewalks. It's just a beginning, but we were pretty proud of ourselves for doing that in that 18-month period, and that's exciting, and we want to go on and do more. That's why we applied for a collaborative grant to do a peer-to-peer exchange with 2 cities that we thought shared things in common with Missoula, and those cities are Iowa City, Iowa, and Eau Claire, Wisconsin. So teams from Eau Claire and Iowa City are here with us this week, and then next month, where are you? Robin Nielsen-Cercone and I will be traveling to Iowa City and Eau Claire to see not just the cheese curds, but more of what they're doing that we could apply to our own experience here in Missoula. So we know in all of our communities that housing affordability is a challenge. We know that 47% of Missoulians spend over 30% of their income on housing, and half of those spend over 50%. We know, as our guest said, that 51% of Missoulians are renters. We know that wages aren't keeping up with the average rent, and we know that housing is health. When I was telling my colleagues on my way over here a little while ago, I was like, I haven't really prepared anything to say, and it's about renters and renting and that renting market in Missoula, and one of my young colleagues said, who just became a homeowner, but she said, go to any bar, any sporting event, any concert in Missoula, it's what everyone is talking about. So I didn't have time to do that because I had to come here, but I definitely know what she is talking about. So thank you very much for being here and helping us figure out what steps we can take to address rental issues in our community. And now I'm going to turn it over to Kaya Peterson, who is our Master of Ceremonies for the evening. So,
Thanks, so official. Cheers up in front and get ourselves Peterson. I'm the Assistant Director of NeighborWorks Montana. Our organization is statewide, based in Great Falls, but I'm here in Missoula. And pleased to be part of the Invest Health team. I think about and talk about housing all day, every day, but a lot of our work at NeighborWorks is focused on home ownership, and it's been a great learning curve for me to start delving into the renter world and really understanding that as a key and critical component of our community and of our community needs. So I'm going to have our panelists introduce themselves, and then we're going to learn a little bit about the two cities and talk more about what's happening in their communities around housing.
Hi, I'm Tracy Heisha in the City of Iowa City. I'm the Neighborhood and Development Services Director. So our department oversees the development services, your urban, your planning, your zoning, your building permitting processes, neighborhood services, which is your housing authority, your Section 8 vouchers, rental inspection, and our MPO, which is our transportation planners.
Hello, my name is Vicki Meany, and I'm from the University of Iowa College of Public Health. I direct an institute there called the Institute of Public Health Research and Policy, so I get to touch all different kinds of programs because public health is so broad. I would say that, working in a college, my position is the one that is sort of the outfacing and the one that's sort of involved in community work as the base of our college.
I'm Marissa Stanley. I'm the Assistant Director of the Eau Claire City County Health Department.
It's not on.
Sorry, you have to press the top. All right, I'm Marissa Stanley. I'm from the Eau Claire City County Health Department. And within our health department, we have a housing program. So we have a routine inspection program and a rental registration program, amongst various other things.
I'm Keith Jonathan. I'm the Executive Director of the Housing Authority for the City of Eau Claire and also the Housing Manager for the Housing Division for the city. What can I say about housing? I'm the Housing Authority. I know everything there is to know. But I just wanted to just say that as part of our Invest Health team included our health department director, our city manager, the assistant chancellor from the university, a gentleman from the Realtors Association, and myself. And we have been working feverishly since this grant began to investigate those needs, prioritize those needs, and collaborate with as many people and organizations as we could. And it has been a very positive experience. We've engaged groups that had never been engaged before. For example, we've got 3 different major medical establishments in Eau Claire, and we've brought them together and had a meaningful conversation, which had never been done. So all around Invest Health, health and adult environment, and the subject of housing. And we will talk a little bit more about that, but I just wanted to give you that background.
Great, thanks. So we're going to watch a couple little videos to give everybody a good feel for these two communities. We're going to try to watch 2 videos. Yep, we'll do Iowa City first.
Who has cheese too, by the way?
We do have cheese.
We have cheese too.
Iowa City is a little bit unique for Iowa. Fun fact about Iowa is we produce 1/11 of the nation's food supply. So between pork, chicken, eggs, of course corn, soybeans, our other leading economic drivers in Iowa are the renewable fuels. We produce ethanol and we do wind energy. Our energy in Iowa City, our electric, by 2025 should be completely renewable by wind. We have advanced manufacturing in Iowa. If you have an Oral-B toothbrush, chances are it is made in Iowa City. And we have a huge insurance and financial sector in Iowa. So those are the main drivers of the Iowa economy. But in Iowa City, our main drivers are education and healthcare. So over 30,000 residents come work in Iowa City at the University of Iowa or the University of Iowa hospitals and clinics. That is Iowa City. Our demographics are very similar to Missoula, which we were amazed by. Half of our population are renters. We have basically a 0 to 1% vacancy rate. We have the highest renter costs in the state. So very similar. We are about 85% white. Our minorities are people of color, represent about 5% Asian, 5% Hispanic, and 5% African American. We're one of the most diverse cities in Iowa, which is not really diverse, but we learned that we are the most diverse city among here. She's who knew in Iowa.
The only other thing that I would add, because you covered it all, but we are avid Hawkeye fans. That's important. When you live in Iowa City, you have to be a Hawkeye.
On game days, our stadium holds 70,000. When we have 70,000 in Iowa City, so we double our population every time Hawkeyes play. Changes our whole traffic patterns.
Wow. All right, so let's learn a little bit about Keith and Marissa, what else do you want to tell us about Eau Claire?
Eau Claire has a population of about 65,000 people, but as a metro area, including the county, we are over 100,000 people. The state university, University of Wisconsin at Eau Claire, our medical industry and Menards are our largest employers. How many people have heard of Menards? There you go, all the guys in the room. Our median income is a few $1,000s short of the state average. Our downtown area has seen some revitalization in the last decade. We've got a project that's nearing completion called Confluence. We call it the Confluence Project because it's at the confluence of the two major rivers in the area, the Chippewa River and the Eau Claire River. And it includes retail and with housing, which is student housing above, and the second phase of it is an arts center, arts and cultural center, that boasts two auditoriums, one slightly smaller than the other. And I can't finish without talking about the music festivals in Eau Claire. We've got it's Eau Claire Festival, but it's with an X at the end of O. And that's a more of a folky kind of Indy, yeah, she's young enough to know those words. And then we have a bluegrass festival, all held at on the same location, different weekends. And then we have country jam. Country jams, that's my favorite. And I think it's coming up to its 20th year. So Eau Claire is pretty much known for those music festivals. Anything?
Great. So tell us a little bit more about housing in your communities. I know with Invest Health, we've all worked on a range of issues, and we'll hear more about some of that as we go along, but give us some more context on what's happening with housing in your communities. You want to start, Keith?
I can start and you can. All right, good luck to me. So our housing in Eau Claire is like any other Midwestern city, very old. You know, we've got from every decade, but a lot of it is very old, like around the turn of the century, the 20th century. Some of it is in disrepair, and I'd say a lot of it happens to be in the area we call historic Randall Park. And Eau Claire is a college town. We have the university right there, and right on the periphery of the university is historic Randall Park. And a number of our students rent housing there. And we know the housing is varying degrees of poorness, but the landlords there don't seem to care that much about it. It's more important for them to rent and make the dollar. And they make it at the expense of those college students who basically want to come and have a great experience in their college years. And it's not that they don't care about where they live, but sometimes, you know, they just have to get that unit. And the landlords don't necessarily keep up with that property. And I talk about historic Randall Park because that's the focus of our project. So there have been some initiatives recently, and I'm going to turn it over to you to talk about that.
All right, so one of the recent initiatives is we have been working on updating our housing code. So our housing code not only talks about standards for housing, so those minimum standards that make a house that is, you know, healthy and habitable for humans with no health hazards, but also puts into place a routine inspection program for all houses in the city of Eau Claire, so not just rentals. And with that, what we do is we do an external survey that looks at, you know, the quality of the external house as sort of an indicator of what might be going on in the inside. We also look at complaints that have come in from renters or neighbors or, you know, garbage complaints, those sort of things. Also looking at the age of the house and different factors. And then based on that, we do routine inspections. And so this new city ordinance actually lays out the process for that, how we give notice, how we can actually, you know, have people that pay for the inspections if there are things that are found to be wrong. If we come back and the things that we've said need to be corrected are not corrected, we can also issue a re-inspection fee. So trying to really provide incentives for people to, and working with people to make the corrections to get the housing up to our standards. In addition to the inspection program, we also now have a rental registration program that requires all rentals to be registered. They pay a $5 fee, and we have their contact information, so that way, if, you know, there's something going on, and let's say the landlord isn't even in the state or the city, we have a way to get a hold of them. So that's been our new initiative this year. It started January 1st, and as of a couple weeks ago, we have about 78% of what we think are rental properties registered in the city of Eau Claire.
In Iowa City, we have 30,000 students. A population of 70,000, there's 30,000 students. They generate a lot of demand. And we find that students outbid families. So if you have 3 or 4 or 5 students that can live in a unit, they outprice any family that wants to live there. We inspect 19,000 rental units on an every other year basis. So we are actually sending city inspectors into our rental units every other year. So the minimum quality standards of our rental housing stock is pretty good. It's not great. You know, you always have problem landlords or problems that don't get reported and wait until we get it out there. So we're only out there every other year, so things can happen with the heat, the water, while we're not there. There is retaliation sometimes that we've heard of, reported about people not reporting problems with the heat or water, and then we won't come upon it until we're out there. So we're trying to make sure people understand that your unit, when you get a rental permit, is supposed to be in compliance with our code 365 days a year, not just once every 2 years. So we're trying to get that message across. We had because of the Invest Health Initiative, we had our rental inspectors, we had a training, we brought up the Children's Mercy Hospital from Kansas City to talk about code inspection for healthier homes, because we're realizing we have such affordable housing crisis that it takes so much money to build new affordable housing that we need to address the housing stock where low-income households are residing now. So those inspectors came up to teach our inspectors about what to look for. We call it the 7 steps to a healthy home, because you have mold, moisture, lead, asbestos, radon, all those things about where you're spending most of your time, and that environment's not healthy, leads to future health problems. So we went through that training, and it was great because we thought it would just be interesting, just the Iowa City folks, but we also we opened it up for Eastern Iowa, and we could take 35 inspectors, and we filled it within a week. It was great training. So now when our inspectors go out there, even if it doesn't meet minimum code, typically we'll talk to the landlord saying, this is going to lead to respiratory problems, or this will lead to this type of problem. And most landlords will fix it. I would say most, because most people try, and then we do have some landlords that have to, yeah, they don't help, but we try. Our owner occupied is expensive, so a lot of people have to rent till they can't afford it. Iowa City is an affluent community, very highly educated, with the university, the regional VA, hospitals and clinics. We do have a lot of educated folks, but then we also have a lot of folks. There's a very huge income divide between high-paying jobs and then support positions at the university and other, and all your service workers. So these folks are really struggling in our housing market to afford. And then after the floods in 2008, we had a huge flood. The central part of our city, where our North Wastewater Treatment Plant was, it was all flooded. So we used a lot of our flood recovery money to take that plant out, to expand our plant to the north or to the south. That led a huge amount of land right by the University of Iowa campus, and we usually have a hard time with infill. We upzoned it. We've had a lot of development pressure now that we restored it to a beautiful park, so it's no longer a wastewater treatment plant. And we're putting a park there, and when we allowed that upzoning, we also put some inclusionary zoning. So if you're going to build higher and denser, then you have to put 10% affordable housing. Well, that affordable housing still follows fair market rent, or maybe a 3-bedroom that could still be $1,400, and that's really hard for a family to afford. That's affordable for our market. So we have building permits for about 1,000 units right now. So the next year and a half, we'll have 1,000 units come online, which is huge for us. That's way more than a 10-year average. I think that's 3 times our 10-year average. So we're expecting vacancy rates to go down, which is great. But even our housing forecasters and our appraisals say it probably won't reduce rents, it'll just stagnate. And then maybe the rent or the landlords will be offering, specials like first month free. But it's something we've not seen in Iowa City for years. So we're excited to see what the new supply will do, but we don't know. So we're hoping it stabilizes and lowers our rents.
I might just add to that by bringing health into the conversation from a public health perspective, because we've heard about the fact that rent is high and folks are cost burdened, and lots of people in our cities are renters. And that impacts health in a variety of ways. I mean, the logical way is that living in a substandard unit that impacts you, right? There's a lot of stress with that. But when you're paying that much out of your paycheck for housing and rental, you also have less money to spend on good, healthy, nutritious food. So that impacts your health. you have less money to spend on deductibles to go to the doctor. Maybe your insurance deductible is $20 or $30 or $100. You may not decide to go to that visit for a preventative health care call because you can't afford it, because all of your rent is going so that you can continue to live in your home, and that has to be the priority. So I think, you know, I just want to make sure that we also pull the health side into all of these things, because housing does impact health, and there's lots of research that talks about that. In this country, you can live within a 5-mile radius and have a difference of 10 to 13 years in your life expectancy. So I just wanted to add that.
Thanks. So I think we should show slides that relate to the solutions that you guys are approaching. So do you guys want to go first and share your neighborhood-based approach? Sorry to switch it up there, Karen. And share some of the work you're doing in that community. Yeah, I don't know. So one thing that's been really interesting about Invest Health is we all started with this idea that we were going to work on the built environment, and that was really the focus of the grant when we all entered this work. And by the last convening, there was a much stronger focus on resident and neighborhood engagement than I think we started with. And that was, to me, it felt like a collective learning process where we said, we all care about the built environment, we see the impact on health, we see the role that that plays in our community, let's work on that. But then in the course of working on these issues in our communities, and I think this was sort of a journey that the Robert Wood Johnson Foundation and Reinvestment Fund took too. After 18 months, we all said, you can't work on the built environment without engaging residents and without working at the neighborhood and community level to really understand what are the needs and what are the solutions that are relevant in the places we're trying to work and for the people who we're really trying to impact. And if we want to shift and improve health equity, we can't be doing that work without really engaging with residents. And I think that's part of what you'll see from these two communities. I don't know if that resonates with you guys. We haven't really talked about that, but I think it's been an interesting journey for all of us.
Okay, we can kind of skip through some of this, but just wanted to highlight a few things. In the entire county of Eau Claire, we have about 32% of the county being renters. And then when you get to some of the centrally located neighborhoods in the city of Eau Claire, we have neighborhoods that have over 80% renters. So definitely, you know, a big contrast in different parts of the county. One other thing I wanted to point out on this slide is that our UW Eau Claire student population is a little over 10,000. And one thing that is a challenge for us is that campus housing only houses about 41% of the students. So one of the things that we're really looking at in the city of Eau Claire is how do we get more student housing, and you know, how do we get them in sort of university sponsored housing.
So in Invest Health, we chose Randall Park. We chose it because they were willing and they were an engaged neighborhood. It's an area where social determinants of health demonstrated that there was a need. We're surrounded by major employers in development and the university. We've got 58% poverty, and that's people who are at 30% of area median income. There's also a high fraction that are cost burdened, spending too much for rent and expenses, utilities, etc. There are a lot of advantages to central neighborhoods as well. We have a large concern for gentrification, and that neighborhood location and housing diversity will be increasingly desirable as downtown is revitalized. and reasonably priced rentals or owner-occupied homes will be priced out. This is our pipeline diagram, and this is our approach to the central neighborhoods. It represents the concept that a series or pipeline of projects is needed to tackle large issues. A one-and-done project will not meet our goals. We have selected historic Randall Park neighborhood as our pilot and believe that there are 5 main sectors that we need to work on to move projects through the pipeline to realize the goals of decreased injury, decreased chronic disease, and improved mental health and social connectedness. Note that financing and stakeholders make up the exterior of the pipeline. They hold the pipeline together and help projects move through it. These are the 4 areas for opportunities that we will be focusing on related to housing, food, and physical activity. We want to make the healthy choice the easy choice. As a community, we have already begun this investment in our communities through the Neighborhood Revitalization Task Force in 2016, the TIF ordinance, the TIF dollars from Water Street to go toward neighborhood investments within a half mile of that area. Starting in 2019, $100,000 of increment will be captured for the neighborhood each year for 20 years. This is the first time we've done something like this in Eau Claire, and it is a big deal. Tag, which is an activity and rec center in partnership with UWEC, Mayo, and the YMCA, will be right here. So that Tag Activity and Rec Center is going to be in partnership with the UWEC, Mayo, and YMCA. And they are considering healthy food or an exercise prescription program, food pantry locations, and creative ideas to make the center more accessible to neighborhood residents. Just Local Foods is moving to a space near Water Street. It will be the first floor of a building with 3 more floors that house students. There's a need for creative options to help the co-op products be affordable for low-income neighborhood. And then we've got the Cannery District up on the north side of the area. It's not really in the Randall Park area, but it's just outside, and we like to include that in our conversation. And it is pretty much the only area with vacant land. We are considering workforce affordable and mixed income housing here as in this former blighted industrial area becomes a city park and a commercial space near Mayo in downtown. So the approaches that we are taking to address the housing challenges, particularly related to renters, include, obviously we spoke about the housing ordinance and rental registration. A new position was hired to manage this from a health department perspective. And the approaches that we're taking are thanks to a high level of community engagement through the ordinance process, very little pushback on this, and it passed on the first attempt. Not all communities in the state have been that fortunate. There are more things that we wanted to touch on regarding that neighborhood. We have that neighborhood organization. They formed a neighborhood revitalization corporation. What they will do is focus on housing rehabilitation. As a part of that housing rehabilitation, we will be offering community development block grant rehab loan funds that will be specifically targeted to that neighborhood to help those existing homeowners with some needed repairs. That corporation will also be creating a program to purchase homes and renovate or tear down and build new, which will help create more homeownership opportunities. We've also, I mentioned the TIF funding, and then we also have a community development funding institution, that's Rural Credit Union, that's also within that neighborhood, and they're developing programs to help those potential homeowners who are unable to get traditional funding. And we are also looking at employer-assisted housing. We've got several major companies in the area, one being Mayo Health Systems, another Jamf, which is a major computer software company that has located in Eau Claire. We've got county and city governments. And the conversation was started about the potential of those organizations purchasing and renovating homes for their employees to eventually own.
Thanks, you guys. So some really great examples I think you're hearing there about all of the different entities that you guys are engaging, from your local business anchors, your hospital, and then really drilling down into one neighborhood to find both policy and sort of financing and market solutions. Is that really a broad approach, right? So I think we'll hear from Iowa City a little bit more about primarily the policy work that they're doing, and then we'll have some time for question and answer. So hopefully you're already seeing some themes and things that are percolating for how this might relate to our work here in Missoula.
I forgot to say this, but thank you for offering us a chance to collaborate and come out to Missoula. I have never been to the Northwest, and your city is just beautiful, so thank you. After I walked to the end, I emailed my husband, I showed him the pictures. Well, okay, we didn't make it to the end, we made it about halfway to the end. We were talking. I got it, thank you, you're very kind. I was gonna say, I'm either out of shape or it's elevation, so I'm gonna go in the elevation. So next time I come back, I'll be ready. This is a slide that I normally give to people when it talks about policy, what we're doing to address affordable housing in Iowa City. I won't go through all of it, but we talk about what affordable housing is, and we define that basically you're paying only 30% of your income on housing costs. In Iowa City, this is our median income. We go by 80% median income. That's who we can assist for home ownership. For rental, we can assist people below 60% of median income. I just gave a sample basically from our last labor statistics about what people are making, especially in the service industries or in different support positions in Iowa City. These folks are going to struggle in our market, and I'm guessing that these folks will struggle in your housing market as well. And I'm always telling people, because there's such resistance to putting affordable housing or multifamily housing in people's neighborhoods, that our area needs people who need affordable housing, because our economy just doesn't work unless those folks are there. And our belief in Iowa City is that if you work in our city, you should be able to live there. It's just sustainable. You're part of our community, so you should be able to live in our community. Recent trends in Iowa City have not been good. Poverty is increasing quite a bit. The number of language, we're having a hard time communicating with different folks in different neighborhoods, because in our best health neighborhoods, when we surveyed them, about 25% spoke a language other than English. And it wasn't just one language, so it wasn't like we just had to worry about Spanish and getting a Spanish translator. We had to worry about French, Arabic, Swahili. So we're getting a lot of Sudanese and Congolese population in some of our best health neighborhoods, but we're having a hard time communicating with them. We're finding that at our elementary and our kindergarten levels, that kids are coming unprepared more so than anywhere else in the state because of basically its English barriers. So we're adjusting. You know, it's a new trend for us, and at the same time, while our housing values are increasing, our income is decreasing. So it's not a good combination to have. Oh, and that was an interesting statistic. So in Johnson County, we grew by 8,000. 5,000 were international visitors. So people are coming basically for the to be near the University of Iowa, the University of Iowa hospitals and clinics. And we're just trying to figure out how do we reach these populations and how do we communicate. Our fair market rent, so 3-bedroom, fair market rent is $1,400, 2-bedroom, $1,000. So it's an expensive rental market to be in. We always talk about what we want to do as planners, especially in Best Health, is that even if you're in a neighborhood that has primarily low-income folks, how do we make it so that you're in a community of opportunity? How are we providing the grocery stores, the entertainment, the jobs, access to things that you need, better schools in all neighborhoods throughout Iowa City? Just going to skip through some of these. We also combat myths about what affordable housing looks like in Iowa City or what subsidized housing looks like. So these next examples are just, this is a low-income housing tax credit project, what we call LIHTC, townhomes in Iowa City. This is owned by their housing fellowship. They rent affordable housing in Iowa City. We're also working with the private sector more than we ever have. So we're providing rental rehabilitation loans at either 0% or we're granting a certain proportion so that they can improve their housing. Not so it looks like Taj Mahal, but so that it's just decent, affordable housing qualities. After the floods of 2008, I told you we bought out about 100 homes in the 100-year floodplain in Iowa City. That's a huge loss to your property tax base. So the state came back with a program called the Single Family New Construction. So we were able to build 141. So we bought out 100 homes, we demolished them, dedicated to permanent green space. And then we built 141 homes that weren't in the 100 or 500-year floodplain. And all those homes had to be affordable, basically. They had to sell for less than $180,000, and more than 51% had to be for people below 80% of median income. So this is our action plan. So the council back in 2016 asked staff to come up with suggestions about how we can help affordable housing in our community. So we listed 15 steps, thinking they take 6. They took all 15, so that's what we've been trying to implement. We have different programs. We have the GRIP. So we are entitled city, just like Missoula. We have CDBG home funds, and we have an owner-occupied housing program that goes up to that 80% median income. We bond for $200,000 extra so that we can help people below 110% median income. So we get an interest rate about 2.75%, so people can do repairs up to $40,000 to their home, and then they pay it back over 20 years at the city's bonding rate. We also have a program called the University Program. So what we do to stabilize those neighborhoods that are close into the university, we've purchased 65 rental homes. We've put in $50,000 of rehab into them, and then we sell them as owner-occupied. So we try to cluster them, so we're bringing back owner-occupants to some of these neighborhoods that have a lot of neighborhood complaints, a lot of declining property values. Sorry, we don't have declining property values, just, I'd say, deteriorating properties. GRIP is General Rehabilitation Improvement Program. So people apply. Usually if they can take our federal funds, they'll go to the federal funds, but if they're over 80% median income, or they want improvement that the federal government or the home program won't pay for, such as garage or a new addition, they can use GRIP for that. We also, in that area that we talked about where it was flooded, we adopted inclusionary zoning, so now 10% of those units have to be affordable. We adopted code amendments to get a fuse project in. Does anybody know what fuse? Oh gosh, I can't think of the acronym. Vicki? Okay, I'll tell you what it is. Our homeless provider is providing 24 SRO units to chronically homeless folks that are usually joint diagnosis of chronic homelessness and chronic substance abuse. These are the folks that cycle in out of your emergency rooms, your police, basically your high-cost intervention services.
Frequent utilizer.
Frequent user. By the end of the day, we can think of it.
Yeah.
But anyway, so that way, the folks will get, so we identify those folks that are, cycling in and out of our police and our emergency rooms. We provide them a unit in this apartment complex. They get a Section 8 voucher so they can live there. And they don't have to accept supportive services, but we're hoping as their lives stabilize that they're more willing to take on the substance abuse and the mental health services that will be provided. So they just started digging this month, and so hopefully after this construction season, it will be open. But that was hard to push through because whatever neighborhood you put that in, nobody's gonna want it. Because that's 24 high, people that people don't want to live by typically. And they will have a program manager that's 24/7. So we enabled the zoning so that by special exception, it could go in the community without HEPA. We enabled it so you didn't have to go through a special exception process. That was the one thing. We now locally budget money for affordable housing projects. So in the fiscal year 19 budget, we budgeted $1 million. It was 18, so we'll budget another, so in addition to our City of Eugene home funding. Then with that money that we budget, 50% goes to our housing trust fund in Johnson County. The state of Iowa has a housing trust fund that they fund, and that if your county happens to be a trust fund, they get an annual appropriation of money. It's been about $300,000 to $400,000 a year. So we're giving 50% of our funds to them to administer the programs and have them. Our LIHTC, our low-income housing tax credit, you get more points if you can get the local housing trust fund to fund your project as opposed to the local government. So we're just going to funnel our funds to the housing trust fund for that. We're starting land banking. We have $600,000 now accrued for land banking. We will buy our first property probably the next month. It's just one lot for 6 townhomes. We're hoping to accumulate enough land so that we can do a LIHTC project so that we can have about 40 units and then take out RFP to developers. We have 5% reserved for emergent situations. That's hard to define, but that's like if you have no rezoning necessary and someone's going to be displaced, are there any funds for them to access for relocation? So we have that, and then we're dedicating 20% of those funds to LIHTC projects. The Housing Authority, due to the sale of public housing units from years ago, had extra funds. City council did not want, previous city councils did not want to increase the number of public housing units that we had, so that money just sat there in the Housing Authority for several years. The council that we now have basically says let's address the affordable housing issue. So when we go through a new development project, we have those funds and we're purchasing 11 units in downtown properties, mostly for elderly and disabled folks to live, and then we have another 420,000 remaining. We're changing our annexation policy so that when you annex into Iowa City, our goal is that you agree to do 10% for affordable housing. So that means you can either you can sell it to the city for land banking, you can sell it to affordable housing provider, you can use it in a LIHTC project, or you can build housing that is targeted for these populations. So that just went through P&Z, it'll be going through City Council this summer. And we're starting to use tax increment financing, which I think Missoula has tax increment financing too. So in Iowa, when you do public infrastructure, if you use it for public infrastructure for residential subdivision, a certain portion has to be dedicated to affordable housing anywhere in the city. We've not utilized this tool to date, but we have 2 main roads that we will be assisting the private sector with. So we will start using it in the next year. Then we're doing regulatory changes to our zoning code that will allow waive parking requirements for affordable housing, review our multi-family design standards. If we are making the price expensive, could we waive, could we change that for affordable housing? We're eliminating your minimum size for our planned unit developments so that you can build smaller housing by right. And we're also trying to look at form-based codes so you can permit more housing types by right. So you don't have just subdivisions of all single-family homes, that you have a mix of multi-family, townhomes, duplexes, so that no matter whatever your income is, that you have a chance to live in all neighborhoods throughout Iowa City. Okay, that's all right. I already talked about the LIHTC. We put a committee together to talk about tax abatement. The state of Iowa allows you to abate taxes for 10 years for affordable housing. But we're working with private developers to find out how much do we have to abate in taxes for developers to even take us up on that. And what we're learning is it's not really feasible until you get to about like 25, 30 units. So it basically is only going to be a tool for multifamily. So we're still investigating that. We do have affordable housing location model. I'm not going to talk about it here, but we're exempting more parts of the city from that location model so that we can encourage affordable housing in larger parts of Iowa City. And we just approved a tenant displacement plan. So if a developer doesn't have to go through rezoning and they're just going to displace 12 or more households, if they have to provide adequate notice so that tenants can find other housing. And then our last strategy was rent abatement. In the state of Iowa, I always caution, I always cringe when our legislators and our politicians talk about rent abatement, because that means that we go out there as city inspectors and we say, you have no heat, so we are abating your rent. You do not have to pay rent until that heat's restored. Well, sometimes tenants read that, they have to have an order from us. Now, if they just say, you don't have heat, we're just gonna stop paying rent, that landlord can evict them, and there's nothing we can do. So I cringe when people start talking about it, like, because I don't want people to lose their housing because they think they can do things that they can't do. So I always say, go to Iowa Legal Aid, speak to somebody that knows what they're doing, come to us, because we have to order, the city has to order that rent abatement. You just can't take it upon yourself to say, I don't have heat, my window's broke, and I'm just not gonna pay rent this month, because you're gonna get evicted. We're also talking about what we can do more to impact the housing quality of the housing that you're in. Because at that training that we went to the children at Mercy's Hospital, I did not realize how much time people spend in their homes, especially the very young and the elderly. So with the help of the College of Public Health, we drafted the housing 7 easy steps to a healthy home. We now print this off and it goes into every tenant that has a Section 8 voucher, and it goes to anyone that gets a rental permit. So both the landlord and the tenant has this now. And we've been trying to get this message out to everybody that the conditions of your house do impact your health. And so I'm going after, in Iowa, we go after moisture because we have basements, we have a lot of rain. Moisture just leads to a lot of respiratory problems, leads to pest infestations. So whenever I have to speak to folks, I'm like, make sure you address the water, your storm gutters, your basements, so we talk about that a lot in Iowa. We also talk about lead a lot in radon. So do you have a lot of radon? Okay. So now, like in our university homes and our rehab, we're doing mandatory. So if you're going to get rehab with us, we're going to test for radon, and we're going to say that you have to incorporate radon into your rehab. And that's what we're doing in Iowa City.
Just a few things.
That's what we're trying to do.
Great, so some different strategies and approaches. Do folks have questions or thoughts about what this may mean for Missoula?
I was just wondering whether the TIF funds in Wisconsin are tied to affordability or not. You guys have TIF as well, right?
Yes, we do. Yes, we do. I don't believe that they're tied to affordable housing, but we can use those TIF funds and create whatever program we need to or that we see a need for. And those TIF funds that we're looking at on Water Street will be used for affordable housing in the historic rental park district.
Okay, so there's no requirement that they have to have a certain percentage of affordability. Okay. And then do you guys have a trust fund also in Wisconsin? A housing trust fund?
We don't.
Okay. Just curious. We want one really bad, so.
I think we're looking at it.
Okay.
We've got some people that are looking into that.
So yeah, onto that housing trust fund. In Iowa City, how did you get your city to contribute $1 million to the housing trust fund?
Good question. It wasn't easy. What happened in Iowa City is, I've worked for the city for 20 years, and for about the first 15, previous city councils, they always acknowledged affordable housing was an issue, but they basically said, you have CDBG home funds, address it that way. And then the Chamber of Commerce basically started saying, housing costs are rising so much that people are not wanting to move to Iowa City, that's affecting our job. So I think as the Chamber of Commerce, there's a different pot of folks than our social service agencies complaining and saying it was a huge concern. And then our current city council, about 3 or 4 years ago, decided that affordable housing was a top priority. We also had affordable housing advocates actually form and create an affordable housing coalition that met, and they kept coming to council meetings every time and saying, we need money, give us money. So they were very active, and they were very nice. They had mixers, they'd ask the city council to think, but they kept coming. Every meeting they'd send somebody saying, there's affordable housing shortage, when are you going to start allocating money? So 2 years ago, city council started with started with $1 million contribution, and the next year $650,000, and then fiscal year 19 it's back to $1 million. So.
And Tracy, that money was from general funds, from property taxes and fees.
So in Sioux City, it sounds like there's an inclusionary zoning requirement on annexations, like in the works.
we can't call it inclusionary zoning. Iowa has rent, we can't have rent control in Iowa City. The reason why we were able to do it, the riverfront crossings, is because we upzoned it. So you didn't have to take the upzoning. So if we zone your property to a higher level of density, then we could require affordable housing. Annexations are purely, cities don't have to annex, so you have to have a, so if developers want to annex in, we say, okay, you want to annex in, but how are you going to meet that 10% goal of ours? Because that's the only way we can do it, because there's no rent control in Iowa that's allowed.
So do you worry that that's going to discourage annexation?
No, not so much. Just because the demand so much has been, we've had a lot of pressure to annex in. So we're not saying they have to lose money. They can sell that at fair market value to an affordable housing provider. So I don't think they're going to lose money. It's just, and our zoning code now requires you to have a mix of housing. So when you annex in, you're going to have single family, multi-family townhomes. We're really looking at the missing middle focus, basically stop just developing single family after single family home.
Sorry for the third follow-up, but can people that build subdivide outside city limits?
No. In Iowa and Johnson County, we have a fringe area agreement. So in order to develop in our 2-mile fringe, you have to get permission from the city. We won't get it. So it happens. If we can't water and sewer it. So if you have to be on a private, then we allow it. But if we can foreseeably water and sewer that area, then we would basically say you have to annex in.
It sounds like both cities have a rental registry, right? Rental permits?
That's what we call them. I think you call it different.
Yeah, we're a rental registration.
Okay. And are those funds used for, so you guys are you doing biannual inspections of all rentals?
Yeah. When you get your rental permit, that fee includes the inspection.
So that's totally captured then?
Yeah, it's self-sustaining. It pays for itself.
And for Iowa City, can you explain how yours is funded? Or sorry, Eau Claire.
Yeah, for Eau Claire, our rental registration fee is pretty minimal. It's only $5 per rental unit. So we are looking at trying to subsidize our housing program with the inspection fees. So if our inspectors go out and there are violations, they do charge a $90 inspection fee, and then we have re-inspection fees. So it's really, trying to, with the fees, get the property owner to really get that house up to code and be working on things.
Are these like HQS inspections, like full inspections?
I'm not sure what HQS is, but it's
They're not housing quality standards, they're like HQS on steroids. They did have the HQS standards form to go on when they were establishing the guidelines for inspections, but it's a little bit more substantial than HQS.
Just one thought on that is, what's the pushback in the private market? What do landlords? Has there been pushback? There have.
Oh, yeah. We have HQS, so if you have a Section 8 voucher, you have to go HQS, but our rental permit is you have to meet we have a housing code in Iowa City, so when our rental inspectors go out there, you have to meet the minimum housing code, so it is a little bit more intensive than HQS. And our fees, I think it's $160, and that gets passed on to the tenants, so we're very, landlord just doesn't pay that out of their pocket, it gets incorporated into rent. So it's a balance of what Iowa City has always had, just because of the huge student market. We've always had rental inspection. We've had it for the last, I've worked at the city for 20 years and we've had it since I started. So our landlords are used to it, so they pay the fee, but there's always pushback. We raise the fee about every 5 years, and when you do that, you're basically saying you're making this unaffordable, so there's pushback.
Yeah, and we get the same thing.
We've gotten the same thing. Our program is new, so this is the first year that it's been happening, and we've gotten especially when people don't necessarily understand the process and what we're looking for. So one of the things that we've been doing is, you know, if we're gonna go inspect a property, we're giving them at least 21 days notice. And we're also providing them with a checklist of everything that we're gonna be looking for. So that way, if there are, you know, major things, you know, they can even give us a call and say, hey, you know, we're gonna be working on this, would you be willing to come back in, you know, a month or something when we've had a chance to do this. So we do try to work with people, and we try to make it really clear what we're gonna be looking for, and, you know, just to sort of minimize then the inspection fees that we're having to issue.
Other questions?
Thanks. This is a question I'll put out to the room in general, so if anybody else has an answer to this, they'd like to come, I'd be happy to hear it. Now we're offline. You folks from Iowa City mentioned that you were to build, if I have the numbers correct, 1,000 units, and but based on your analysis, that was at best going to hold the prices flat. I'm really interested in that question of what it takes to move the needle on housing, and frankly, I have no idea how to approach it. So anything you could say about how to actually assess the size of the problem and how much you need to build to affect prices, I would be happy to hear about it.
Answer is I don't know, but in a year and a half I'll be able to tell you. So once those, we think logic, you have to build more, and at some point you'll meet the demand and prices will either go down or stay the same, or at least not increase like they have been. So after those units go online, I'm always amazed we get new, we keep getting more permits for multifamily in this district. I keep thinking, I don't know where all these folks are coming from, because the university's not increasing enrollment. We are getting a lot more immigration, international immigration, but that 1,000 units is a lot. I mean, for a community of our size, I mean, we're not Chicago, so our property owners are worried, especially our student housing providers, and our largest student housing providers thought that they'd be okay because they don't have a lot of debt. But these smaller property owners that might have older housing that haven't invested in a while, they'll hurt because they're vacancy. People won't move in. See if you can move into a much nicer unit at the same price, you're gonna do it. So we'll know. We have a huge push in August. We will rent out probably 400 of those, and then the rest will be next year. So we're looking to see what happens to our rental market. So we'll be able to tell you in about a year.
Thanks.
And that mirrors, I think, what we're seeing in part in Missoula. I mean, others here may be able to speak to it more than I can, but what we've seen is with a huge number of multifamily units going in, it's exactly what Tracy's describing, that the lower standard units are either lowering their prices or increasing their quality. And so overall, we may be increasing the quality of our housing, but the prices aren't going down, even with more units online. So it is really hard to answer that question because those three things are constantly at play. That's my take anyway. Any other questions? Thank you so much. Join me in thanking our panelists. We're so lucky to have you visiting us. I just wanted to say a couple more words on what's happening with housing in Missoula and also where we're headed next with our Invest Health work. So many of you know that City Council and the Missoula Office of Housing and Community Development, Helen can speak to it better than I can, but are in a big process of reviewing the recommendations from the Missoula Organization of Realtors consultant report and working this summer on putting forth recommendations to City Council. So if you have an interest in these issues, it's a great time to get involved. City Council meetings are on Monday nights. City committee meetings are on Wednesdays during the day. There's always time for public comment and the opportunity to get engaged. Forward Montana has a renters union that they're really working to build up and share renter stories. I've been really interested lately in some articles that talk about home ownership as a cartel, that once homeowners are established, there's no incentive for them to allow additional kinds of development to happen in their community because those individuals already own property and the incentive is for them to protect that property. And I think that our awareness about renters and renters' needs is going to have to come not just from renters, but also from property owners. So Forward Montana is a great place to connect with. And then in terms of Invest Health, we're really trying to figure out where we plug into this housing conversation. That was part of our interest with bringing these two teams to Missoula and having this event tonight. There are a lot of really smart and creative people working in this field, and there's obviously a huge need. So one of the things NeighborWorks Montana is going to be launching and hopefully engaging Invest Health in is a listserv to start to help educating people more about housing issues here. So it'll have articles about housing and these issues. I think people just seem really hungry for more information, like, well, what is that housing trust fund, and how does low-income housing tax credit work, and what happens if you build more housing? How do we actually solve this? So we really want to create more opportunities for learning and those conversations. So we'll be using the signups from tonight you guys will all be on that listserv, and if you don't want me, you can just opt out after the first one, but the first one will be coming out in early June. And we hope to also help support some other similar community conversations on different topics as people are interested. So thank you guys so much for coming out, and look forward to continuing the work with you. All right.